Bismillahirrahmanirrahim. The topic of this lecture is ethical issues consider concerning research or while doing the research. Like in our previous lecture, we defined the ethics in that it is in accordance with the principle of conduct that are considered correct, especially those of a given profession or group. Now that's ethical that whether in whatsoever profession you are working, whatsoever field you are doing your work or research, you need to ensure that there are certain guidelines, certain principles, certain code of conducts which is considered correct, and that should be given, that should be followed uh, with true letter and spirit. Now, what are the ethical issues which are considered concerning research participants or the persons? The very first is one is the collecting information. One could ask, why should a respondent give any information to a researcher? Is it ethical to disturb an individual even if you ask permission before asking questions? Why should a person give you his or her time to conduct your research? And your information for requests or your request for information may create anxiety or put pressure on a respondent. Is this ethical? At times, your observational study, it might lead to arise some certain arising of confusion in a person, he being continuously being watched by you may lead to disturbances in his activity. Is it ethical to observe a person while he is working, closely observing him or her, and you might disturb his or her activity? Research, you need to understand, it is required to in order to improve the conditions. Provided any piece of research is likely to help society directly or indirectly, it is acceptable to ask questions if you first obtain the respondent's informed consent. Before you begin collecting information, you must consider the relevance and usefulness of the research you are undertaking, and you should be able to convince others of this too. Whether this information that you might be collecting, it might provide some solid, promising solid results which might be applied for the development of the field that you are, or even the participant is working on, and it will be very much helpful, in creating awareness. And you should convince others that what is the importance of your research, why a person should give you his or her time, to collect the information. Why should he give you at times a blood sample, let's say? Why should he be providing a research with that? What is the importance? Why should it be conducted? So seeking consent is the far and very first step in a research. In every discipline, it is considered unethical to collect information without the knowledge of the participant and their expressed willingness and informed consent. Informed consent, it implies that the subjects, or the participants of the studies, they are made adequately aware of the type of information you want from them, or they are well aware about the nature of the sample, their possible, route of collection, and the rest of the data, the confidentiality, everything is being adequately being informed to the participant, and why the information is being sought, why you are collecting the sample, why you are asking those questions, why you are doing the observations, what purpose it will put to, and how they are expected to participate in the study, and how it will directly or indirectly affect them during the course of the study, as well as once the findings of the study they are published somewhere. So it is very much important that the consent should be voluntary and without pressure of any kind. And you might be well aware now that the consent should be a written consent. You put out all the details of the person, and then you take their signatures on that consent form to ensure that they won't it won't lead you into any sort of trouble legally, especially during the course of your work and after once you are done with your work. So you need to ensure the rights of the participants of the study, as well as you need to ensure your rights being a researcher. Now, especially When related to participant research participant, another important consideration is seeking sensitive information. Certain type of information can be regarded as sensitive or confidential by some people, and thus an invasion of privacy, asking which may upset or embarrass a respondent. Sometimes, especially in biomedical sciences, we have observed there are certain diseases we are stigmatized. People, they feel embarrassed to talk about certain diseases, the different, even nowadays, this in developing countries such as Pakistan, the coronavirus, it is also being stigmatized, and people they avoid talking. If they've even developed the sign and symptoms, they develop the disease, and you just try to get information about the disease in simple discussions. The people, they avoid it. They won't give you a direct answer. They might you know they might not disclose their disease. They just say, we have just got a viral flu. No, it's not corona. It's not something. It's definitely something else. So the disease, as simple as coronavirus, as simple as, this is the route of transmission is aerosolic route, a direct contact with the infected sample. So such sort of disease, some people, they might be feeling embarrassment about it. And you can talk about the advanced diseases such as sexually transmitted disease. You can think of the person's perception of the same person. So it might be very hard, it might be very upsetting for the respondent at times to talk about certain data. They might not open up about certain conditions. However, the required information may be very vital for the researcher, or very vital for his or her study. So you need to get that information. A person might have contacted, let's say, HIV, hepatitis B, HCV, and your study requires that you should get information about the most common route of infection, route of transmission. You might ask the person, how did he or she has acquired that specific disease. That information might be very much vital for you. So you will be asking that information. You need to collect it. So it's up to you, it's your consideration, it's your consent form, it's the way you execute your questionnaire, it's the way you execute, you take out the samples, you convince the participants of the study about the beneficial aspects of your work, how is they are going to impact put impact on the disease, let's say. And some questions on drug use, for example, history of disease or acquisition of disease, such as AIDS, sexually STDs, or economical status of, or at time intrusive. The people, they might, feel embarrassed about whenever you ask them about what is their some income, how much money they are making in a month or year. Even marital status, income, or even age may be considered an invasion of property by someone. So, in collecting data, you need to be careful about the sensitivities of your respondents. You need to ensure, you need to convince them that their confidentiality will not be disclosed, will not be compromised. And that's the most important thing, that sharing information about a respondents with other for purposes other than research is unethical. You cannot disclose information about your respondent, with others for with purposes other than research. Even for the research, we usually assign different, IDs to the respondent's name. So it's the researcher or the super who might be the few persons who might know the uh, true nature of the person, yeah, true identity of the person. They might be aware about it, but rest of the people, they shouldn't be provided that information. And one should ensure that the information provided by the respondents is kept anonymous. In certain type of study, you might need to visit respondents repeatedly, in which case you will have to identify them until the completion of your visits. In such situations, you need to be extra careful that others who do not have access to the information, you know, because when you repeatedly visit some person, then even their neighbors, even though they're nearby, or even your, close person near to you, they might, get some information about those respondents. So it might not be good or beneficial for them. It might lead to their breach of you know, their privacy. So it's important to consider it, and it is unethical to be negligent. in not protecting the confidentiality and anonymity of the information that has been gathered from your respondents. Another important ethical issue to consider while concerning the now the researcher is avoiding biasness. Bias is a deliberate attempt either to hide what you have found in your study or to highlight something disproportionality to its true existence. A person, he might be favoring some phenomena, he might, in your study, he might be hiding some important information to favor some other findings or results, or he might be highlighting some of the results, comparably in disproportionality to its true existence, true values, whatsoever you have, a person researcher might have got, those true statistics, they should be disproportionality is being expressed, and it is absolutely unethical to introduce bias or favoritism into a research activity. If you are unable to control your bias or favoritism, you should not be engaging in the research. Remember, it is the bias that is unethical and not the subjectivity. Subjectivity is something else. You might be having your own opinion. You might be having some phenomena. You might be having some results, some novel findings, and that is being, that is being reflected in your finding. That has been reflected to your research paper, article, your submission to a workshop. That is okay if you have got, you have inclination towards a phenomena and your findings, they have unintentionally produced those certain results. That's absolutely acceptable, because deep inside you, it is the conscious of the person, of the researcher. He knows that the finding that he has got, they are true, the figures, the values, they are true, although they are inclining towards the phenomena which the researcher is already having some, might be having some sympathies, or he would like to have those values, and they are unexpectedly have been reported in your study. That's fine. That subjectivity is okay, but one should not intentionally hide some important readings, values, or he might be highlighting some other phenomena which is favored to him. And considering, sorry, the research, another important consideration is using inappropriate research methodology. A researcher has an obligation to use appropriate methodology in conducting the research. It is unethical to use deliberately a method, a procedure, a standard operating procedure to be inappropriate to prove or disapprove something that you want to, such as selecting a highly biased sample, using an invalid instrument, or by drawing wrong conclusions out of your research methodologies. So this sort of behavior where a researcher, he or she uses inappropriate methodologies, to get some results favored by him or her, that is not acceptable. That is unethical. Then another thing related to it is the incorrect reporting. A researcher, he should have these ethical ethos to report the findings in a way that changes or slants them to serve your own or someone else's interest is unethical. A person should not slant. He should not, put up the finding, report the findings in a way that favors some particular person, some particular person's interest, funding body's interest. It's not ethical. It's not acceptable, and therefore correct and unbiased reporting of the findings are important characteristics of ethical research practice. Now, there are certain issues which are concerning the sponsoring agency or the funding agency. That includes the restriction imposed by the sponsoring organization. Most research is carried out by using the funds that are provided by sponsoring organizations for a particular or a specific purpose for a specific set of experiments. And these fundings may be they may be provided to the research team, to the research supervisor and researcher himself or herself to develop a program or to evaluate it, to examine its effectiveness and efficiency, To test a product or to study a phenomena, issue, or attitude. There can be broad range of experiments that can be conducted, that may be uh, executed during the course uh, of the research, whose funding is provided by a sponsoring authority. So sometimes there may be a direct or indirect control that is being exercised by the sponsoring organization. That is, the sponsoring, you know, organization or the funding body, they might be selecting a specific methodology. They might be prohibiting the publication of what was found originally, or impose other restrictions on the research. They might uh, ask the research, they might direct the researcher to use some specific, you know, instruments for their work, to publicize it, to, to highlight that instrument. They might be asking for some other manufacturer's item specifically being utilized for the work. At times, they might, direct the methodology, in this way. Both the imposition and acceptance of these controls and restrictions by the funding authority, especially we are talking about the unethical execution of these powers. These are they are not acceptable, as they constitute interference and could result in meeting vested interest of the sponsor. The sponsors might have their own interest. For example, in medical researches, there might be some therapeutic interventions that the sponsoring agency might be favoring too. So they might be requesting, they might be directing the research in a way that the findings may address, the mining might incline toward that specific therapeutic intervention, and they might be, depressing, decreasing the beneficial aspects of some other therapeutic interventions, and they direct a research not to report those findings, and instead to report the finding which they feel that it's in their interest. That is not acceptable. And again, some other ethical issues relating to the sponsoring agency include the misuse of information. How is the sponsoring body going to use the information that has been collected, that has been provided by the research, and how is this likely to affect the study population? At times, the sponsoring organizations, they use research as a pretext for obtaining management's agenda. For example, small scale, not significant results to promote a therapeutic interventions. You know, management's agenda or the sponsoring agenda is, even you've got very miniature results, preliminary results, they are not significant results, but they might ask, direct the study, direct the research, direct the research supervisor, the researcher as well, that they need to promote a certain therapeutic intervention, and they drive the research in that direction. It is unethical to let your research be used as a reason for justifying management decisions or their management agenda when the research findings do not support them. That is important. However, it is recognized that it may be extremely difficult or even impossible for researchers to prevent this from happening. That's important consideration. So these are different ethical issues which needs to be considered by the participants as well as the researchers as well as the sponsoring agency. Thank you so much for listening to the talk. Thank you.